All right. Looks like we have a good audience. I think we can get started and some people might trickle in. But thank you, everyone, for joining us today. We're really excited for today's webinar on how to scale high-touch hiring, engage, convert, and retain healthcare workers. My name is Jen Lupton. I'm the Chief Revenue Officer here at Incredible Health, and I'm joined today by David Campbell, our Regional Vice President. We're thrilled to spend some time with you unpacking how leading HR teams in healthcare are really evolving the hiring process because, frankly, we believe, and I'm sure you hear, the candidate experience is broken. So for today's agenda, we're going to explore three things. We're going to talk about what's happening in the hiring funnel now, what's causing so many healthcare applicants to fall through the cracks, and what leading systems are doing differently to stand out from their competition to really improve retention from day one. The Incredible Health team will follow up afterwards with a recording of the event. In the meantime, please feel free to ask any questions along the way by putting them into the Q&A box, or you could email questions@incrediblehealth.com. Before we get started, I wanted to take a minute for both David and I to quickly introduce ourselves. Like I said, I'm the Chief Revenue Officer leading our go-to-market efforts and teams. My career began at Grubhub, where I was one of the first of 20 employees to start there. I really led the corporate business from inception to when I left, we were doing over 350 million in annual sales, culminating in a successful IPO in 2014. I then spearheaded US expansion efforts at Signal AI, an AI software business, transforming how organizations mitigate risk and strengthen reputation. Now, at Incredible Health, I'm really proud to be helping over 1,500 US healthcare employers bring greater speed, higher quality, and measurable cost savings to their hiring strategies. David, before we start, would you mind sharing a little bit about yourself, Incredible Health, and the mission?
Yeah, of course. Thanks, Jen. And hello, everybody. I'm really thrilled to be here today. My name is David Campbell. I'm a nurse by background, actually, but I've spent the last 14 years scaling B2B partnerships. Particularly over the last 5 years, I've really been focused on leveraging AI to transform that business, the way businesses operate.
Great, thank you. So before we dive in, I wanted to ensure everyone has a quick overview of Incredible Health. Incredible Health was started in 2017 as a career marketplace connecting qualified tenured nurse talent with hospitals and health systems across the US. Healthcare employers rely on Incredible Health's career marketplace to fill permanent roles, close staffing gaps, and ensure consistent clinical coverage. 1 in every 2 nurses in the country is on our Incredible Health platform. We've also been building with AI since the launch of ChatGPT. In December 2023, we became the first healthcare career marketplace to add AI, supporting better matching, automated messaging, and interview scheduling. Last year, we announced our new suite of tools and features that we call Incredible AI. This includes our 2 AI voice agents, Lynn and Gail. Lynn is the AI voice interview agent for employers. Lynn is a trusted co-pilot that amplifies brand and reach nationally, engages candidates with personalized outreach, conducts interviews, and sells an employer's unique attributes to highly sought-after healthcare workers. Gail is the AI career partner for healthcare professionals used by over 1.5 million US healthcare workers on Incredible Health's career marketplace. Gail is designed to make every healthcare worker's job search more empowering and inspiring, ensuring they're confident and prepared for interviews and healthcare employers. All right, well, I want to start with a story that I'm sure will sound familiar to the many on this call, a story that we're hearing regularly from our clients and nursing talent. I want you all to meet Carmen. Carmen's a telemetry nurse with over 5 years of experience. She's a calm presence under pressure and has a reputation for picking up even the most subtle signs of patient deterioration. She's exactly the kind of hire you'd want on your team. After years at the same hospital, Carmen's ready for a new chapter. She's relocating to be closer to family, and she's hoping to gain experience in a larger urban hospital with more diverse and acute cases. She wants to grow professionally and personally. She finds your open telemetry role. The job looks like a perfect fit, and she applies. Her license is active, her references are strong, and her resume tells the story of a nurse who doesn't just show up, she leads. Then Carmen gets silence. No one reaches out to her for 9 days. In our world, that's an eternity. During that time, Carmen receives follow-up from 2 other employers within 48 hours of applying. She begins to question whether this job, the one that was her priority and the perfect fit, is really all that interested in hiring her. And by the time your recruiter calls on day 10, she's not just interviewing elsewhere, she's signing an offer letter. She doesn't respond to your voicemail. She doesn't respond to the checking in email. She ghosts you. And your team is really left asking, why aren't we seeing qualified candidates accept more roles? But the problem didn't start when Carmen disappeared. The issue started long before the offer. It started on day one, the moment she clicked apply and didn't hear a word back. Ghosting isn't just a frustration, it's a symptom of an experience gap. And closing that gap starts long before an offer letter ever hits their inbox.
Look, we all know that the system is strange, but when you dig into the numbers, it's really clear for us. And we're not just facing a workforce shortage, we're facing what we call a candidate experience crisis. It's widely reported that 75% of resumes are automatically filtered out by an ATS system. This is particularly problematic in healthcare when a nurse could have written RN-BSN instead of BSN, RN. So the system automatically discards that application. What this means is that nurses, techs, support staff who check every single box never receive a call back or message after applying. In fact, our data shows that 1 out of 2 qualified clinical applicants to healthcare roles never even receive a response from a recruiter. We talk to healthcare workers all the time, and one of the recent interactions stood out was with Maya. So Maya applied to multiple roles at a large health system. She tailored every resume and wrote really thoughtful cover letters to all the hiring managers. Days turned into weeks, no emails, no interviews, not even a thanks but no thanks. When we spoke to Maya, she said something that stuck with us. I think this system just doesn't like me. I've applied to multiple roles there and never heard back. Here's the reality. Maya was qualified for these roles, but the process failed her. The health system not only missed out on a really strong candidate, they also created a negative impression with someone who could have been an advocate for their brand. The experience people are having right now isn't high touch, it's silence. And that's really a brand problem for these health systems. When candidates feel ignored, that message travels in reviews and word of mouth and in workforce perception long before onboarding even begins. And for the best healthcare talent, that's really a deal breaker. Candidates today have a new baseline for what a good experience feels like. And it's not just shaped by healthcare. It's shaped by the everyday on-demand brands that we use, right? Like Amazon, Uber, Airbnb for their favorite delivery apps. Expectations around personalization and immediate response are very high, but it's humanly impossible for recruiters to touch all candidates with the sheer volume of applications. Here's how interactions like Maya's translate in today's hiring economy. 58% of nurses expect to hear back from an employer within 1 week of applying. 48% expect some form of screening or contact within 72 hours, if not sooner. But as many as 90% of candidates say they never hear back at all. So we just talked about newer expectations candidates have when it comes to engagement and speed. But what actually happens when organizations fall behind? Firstly, top candidates don't wait. The most qualified applicants are typically off the market within about 10 days. That's not even enough time for many recruiters to complete the application reviews, let alone schedule a screen. The average time to first conversation for clinical roles is about 13 days, which makes it impossible to compete for top talent. And second, the process itself is often the problem. 42% of candidates say they dropped out of the hiring process entirely because it simply just took too long to schedule that first interview. So if a healthcare is ghosted once, they're often gone for good. 69% of job seekers who had a negative candidate experience, which is inclusive of never hearing back from their application at all, they've said they would never reapply to that same employer again. And so not only are you missing these candidates on one experience, you're missing them essentially in perpetuity. And many employers are really pouring a lot of money into marketing, employer brand. In fact, we found that total healthcare advertising spends about $48 billion in 2025 and projected to grow to over $51 billion in 2026. But no amount of money can really fix a broken hiring experience. All that investment in polishing your brand is just trying to patch a leaky pipeline. And so that disconnect results in missed talent and rising cost. Hiring delays on average cost about $61,000 per RN vacancy. Staffing shortages lead to more overtime, temporary labor spend, and burnout, and this drives more turnover, and the cycle kind of repeats itself. And so when healthcare employees don't respond quickly, personally or really at all, we not only lose interested talent, but we reinforce the issues we're trying to solve. And we can't solve for workforce burnout with a broken front door. If we want to keep great care teams, we have to start by engaging great talent. And so while there are hard direct costs that can easily be attributed to a poor candidate experience and slow hiring funnel, there's really another piece of the puzzle. And so what many healthcare employers don't think about is the retention starts with the hiring process, actually. We recently surveyed hundreds of healthcare executives for our upcoming State of the Healthcare Workforce Executive Report. I don't want to give away too much detail yet since it's not live, but I do want to preview one result. We asked the executives their top priorities with their nursing workforce in 2026, and the number one standout was retention. We hear it in every conversation every day. And so organizations that invest in a strong candidate experience improve their quality of hires by 70%. And 69% of companies have identified a broken interview process as having the greatest impact on the quality of a hire. So, as a nurse, if the hiring process is chaotic, I'm already worried about what the shift change or the charting system will look like. I'm judging your bedside manner before I even really see a patient. And so if you want to solve the retention issue, you really need to consider starting at the very top of the funnel with the candidate experience in the interview. Just a couple more statistics. So half of the healthcare organizations report being inadequately staffed or overburdened. The average recruiter is managing dozens of open requisitions and hundreds of applicants for these requisitions, doing hours of manual screening and scheduling. In reality, they typically only have time to connect with about 5 to 10% of applicants we find, if that, right? And so it's not because recruiters don't care, it's because they're simply just buried in manual work and outdated systems. And so again, a subpar candidate experience isn't a strategy. It's a symptom of a broken system. And when healthcare organizations leave that first 90% of the candidates untouched, there's really no meaningful way to improve speed and retention.
Thanks, David. So David just walked us through a ton of data. So let's really recap what's happening. I think first and foremost, healthcare employers are spending heavily on brand awareness and advertising for their open roles. They're getting a surge of applicants, but recruiters can't keep up, so most candidates never hear back. That creates a poor candidate experience, damages the brand, and causes organizations to miss out on that great quality hire. So if we know how much candidate experience, the bigger question becomes, why isn't it happening more often? The answer usually isn't intention, it's just bandwidth. So how do we fix this? If the challenge is volume, speed, personalization, and shrinking recruiter bandwidth, then the only way to scale high-touch experiences is with smart technology built for the exact reason. And that's where we bring in automation, but not automation that feels cold, generic, or robotic. We're talking about healthcare specialized AI tools that really enable employers to connect with every qualified candidate. At Incredible Health, we're seeing AI create transformation across 3 key areas: speed, quality, and cost. These aren't just outcomes, they're imperatives in healthcare hiring today. Faster hiring means fewer care gaps. Higher quality candidate experience can mean better hires, retention, and care quality. And driving down hiring costs unlocks capacity to invest in people and care delivery, not overtime and temporary labor. Our AI strategy is designed with these outcomes in mind, and every innovation we build ties back to these 3 priorities. At Incredible Health, we're proud of the fact that we have the first AI suite purpose-built for healthcare hiring, Incredible AI. Incredible AI is powered by millions of interactions and data points from the Incredible Health marketplace and is continuously trained and refined to deliver trustworthy and consistent results. It was important that we built solutions to solve key issues for our healthcare leaders when it comes to hiring. So we partnered and developed Incredible AI in collaboration with the teams at Johns Hopkins, Baylor Scott and White Health, Tenet Healthcare, and Sutter Health. And it's already helping over 1,500 employers and 1.5 million nurses. While Incredible Health powers many innovative solutions, the 2 I want to focus on today are our AI agents, Gail and Lynn. Gail is our AI career partner used by over 1.5 million healthcare professionals to prepare for interviews, build resumes, explore roles, and get real-time guidance throughout their job search. Lynn is a healthcare employer's trustworthy co-pilot built exclusively for healthcare hiring. Lynn proactively engages candidates 24/7. She conducts full screening interviews. She sells your organization's unique values and benefits, and then packages it all into structured, bias-free candidate summaries your team can use immediately. David, do you want to go a bit deeper on Gail and Lynn for us?
Yeah. Let's start with Gail. So Gail goes beyond kind of job matching, offering support with resume creation and refinement, interview prep, career exploration. In the past, managing a career and finding a dream job was often super overwhelming. With AI-powered resume creation, professionals without a resume can generate a high-quality one in under 5 minutes, mobile optimized and tailored to them. This really takes the pressure off, helping healthcare workers quickly turn their experience into a polished professional resume. Gale also offers personalized support during high-stakes career moments, including onboarding guidance and voice-based interview preparation. This really provides, the healthcare worker with the experience full of confidence, speed, and reliability, and personalization. Gale earns positive reviews from over 90% of nurses. This data shows us that there's going to be a lot of engagement with the other AI tools that we're introducing. Now let's jump into Lynn. So with Lynn, you can unlock an agent that is engaging with talent 24/7 versus the standard 9 to 5. This allows you to interview hundreds of candidates in days, not weeks. And so what Lynn really does is she instantly engages with applicants the moment they apply or express interest, not 3 days later. Lynn doesn't just message quickly. Each message is tailored to their preferences and goals. It sells the candidates on the details of what makes your organization or geography amazing, and it helps you stand out from your competition. And it really encourages healthcare professionals to take that next step in the hiring process. And this is all without any recruiter intervention. We've chosen voice over chat very intentionally because healthcare professionals engage more honestly and more deeply when they can speak naturally. It really creates trust right from the first interaction. Lynn sees about a 90%, 96% candidate satisfaction score, and nurses report positive sentiment due to the 24/7 flexibility of Lynn. And so Lynn is also able to seamlessly interview for multiple roles in one call. And we've heard this is critical with applicants applying. It doesn't just get a list of jobs, it groups and presents them logically by specialty, shift, location, and really dynamically adapts to the conversation based on what the candidate shares during the call. This process ensures an applicant's never hidden or lost to the competition just because they were the best fit for the one that they particularly applied for. This is something that, when we talk to employers, they're really enthusiastic about. To ensure that you do not lose out on a top candidate, it's critical that you evaluate them for all of these open roles that you maybe have a fit. Candidates being considered for 3 or more roles at the same employer have a 90% likelihood of being hired. And so you can see, absolutely critical to have this in your workflow.
Another positive piece to Lynn is she can also integrate directly into your applicant tracking system to interview 100% of clinical and non-clinical applicants for all their roles. The moment a candidate is moved to a designated stage in the ATS, Lynn receives a secure signal to initiate this outreach. Then Lynn pulls resumes and job descriptions from your ATS. This allows Lynn to speak intelligently about the role requirements, facility location, and required clinical specialties. Once Lynn is done interviewing, your team will receive interview recap summaries for qualified and engaged candidates ready to send to hiring managers. If we are integrated with your ATS, then the summary is uploaded directly to the candidate profile so that your team can manage the talent through their standard hiring workflow. At Incredible Health, we're not just building products and services, we're helping healthcare organizations deliver real clinical outcomes. We use a 3-part success framework to ensure we're driving measurable impact focused on the key areas I just discussed. When it comes to speed, we see 30% shorter total hiring timelines. As a reminder, the most qualified candidates are on the market for 10 days. With Lynn, you're cutting down your average time to first interview from the average 13 days to 2 days, allowing you to get to the most qualified candidates. For quality, we're looking at providing a better candidate experience and also enabling recruiters to focus on strategic hiring work. With Incredible Health and Lynn, you can interview 100% of your applicants, not just that 5 to 10% that you can get in contact with. Not only does this provide a better candidate experience, but it ensures qualified healthcare professionals don't slip through the cracks and everyone learns about the benefits of working for your hospital. And lastly, when we measure the impact on cost, we have found Lynn saves 800 plus hours annually per recruiter by streamlining, scheduling, and multi-role interviewing. So let's bring it all together. Candidate experience isn't just about filling jobs. It's about workforce health, retention, and trust. You have two choices. Keep relying on systems built for volume and risk losing the best talent, or you can evolve how you hire and meet every qualified candidate with speed, empathy, and action. Our goal at Incredible Health is simple: to give your team superpowers, not more work. If you want to see how this can work in your organization, please reach out to David or myself. We'd love to show you what's possible. So that wraps up our content. And now it's time to answer some of the questions that have come in throughout the presentation. If you have a question, feel free to submit it in the question box. The Incredible Health team will be following up with everyone to share a link to this recording. You can also always reach us at questions@incrediblehealth.com or by visiting incrediblehealth.com/book a demo and filling out the form. David, I think you have access to the questions. Do you want to take a look?
Yeah, it looks like we have one question that came in. What's a good rec load for a recruiter should carry to be successful in healthcare with supporting other initiatives or non-negotiable projects? That's kind of a hard question to answer directly in terms of the number of recs. So appreciate the question. I think the way we kind of think about it is, we're thinking about it more from, instead of volume, the candidate experience. And so if you kind of think about what we just talked through is really engaging with the candidates so we can understand what candidates qualify for these roles. So then your recruiters or hiring managers can engage with these candidates who are qualified, because we know, recruiters and hiring managers, the hiring managers especially, are working on the floors and they're going in and out of seeing patients. And so when they get a candidate pool from the recruiters, they want to ensure that they're screened, they fit all the primary requirements. And so we feel a really nice benefit of Lynn is that Lynn can go through and provide this summary so the hiring managers can interview these applicants with confidence that they fit all the main criteria. And then they're really spending the time with the candidates, understanding, are they a culture fit for the facility? Another piece too is clinical versus non-clinical roles. So we talk about this a lot, is clinical roles are a lot more nuanced and complex versus non-clinical roles. And so I think the rec loads kind of change based on those. And so I think the idea here is just to loosen some bandwidth for the recruiters so they can spend more time on those kind of non-negotiable projects rather than kind of trying to get as many phone screens done as possible in a day.
Great. I think there was another question around, after the AI interview, does the system weed out applicants? And I think that's a really great question. I think we have a pretty strong stance on that. I don't know how closely you all are following AI law, but there's a lot of laws that are coming out state level that AI can't make hiring decisions. And at Incredible Health, we very much agree with that. So what we are providing to the recruiters in the summary is whether or not that candidate meets the basic job requirements. You're allowed to see the transcript, the conversation, and all the answers to the questions to allow you to decide whether or not they should move forward, or they should be dispositioned or move to another role. So we provide all this information in the summary, but we do not rank or disqualify specific candidates. That's ultimately the responsibility of the recruiting team. All right, I see. Oh yeah, go ahead.
We have a couple that were sent in. I just wanted to ask one. Can Lynn be used to interview for all of my open roles?
Yeah, we're really excited about this and share that Lynn can really be used to support all roles, both clinical and non-clinical. This is something we know is really important to healthcare employers to ensure that there's one tool that can support all of your interview needs. And the fact that we're specialized and only focus on healthcare, Lynn is able to really understand how to ask the questions around licensing, credentials, and regulatory nuances, reducing compliance and risk for our health systems.
Great. I'm happy to, there's one more, and then I think we can wrap up. What ATS systems do you guys integrate with? We're really proud to share that we're an official Workday innovation partner. This means that Incredible Health connector is pre-vetted. There's zero custom development required for your IT team. Additionally, we work with most other ATS systems. If you have any questions about a system in particular, just send us a quick note to questions@incrediblehealth.com. But we're very open to integrate across a broad spectrum of ATS systems.
Yeah. It looks like two more came through. So how do candidates respond to being interviewed by an AI voice agent? We get this question a lot. 96% of nurses have rated the experience positively, and that is across all generations, not just the new grads. Nurses really say it allows them to interview when it's convenient, including off shifts or weekends. And almost 40% of LIN interviews are currently happening after hours and on weekends. They also share that the voice format feels more natural than filling out the long forms and chatbot flows. And lastly, human outreach always follows. So Lynn starts the conversation, but your team is responsible for closing it.
And I did see we got one more question related to integrations, and I think that was covered in my ATS. But yeah, we're partners with Workday, and we do have the ability to integrate with Oracle.
Great. Well, I wanted to share what I view kind of healthcare hiring to look like over the next 12 months. Because I think that's really important, right? With AI coming out and a lot of innovation helping kind of create efficiencies and automation, it's really important that we're thinking about it in Incredible Health. What does the future of healthcare hiring look like? And my kind of keywords is I think it's going to be fast, I think it's going to be thoughtful, and I think it's going to be stress-free hiring. And to do that, I expect interviews within minutes of applying to a role, zero ghosting, and recruiters really focused on strategy, not playing phone tag, and focused on scheduling initial phone screens. I think that's it for the questions. I really want to thank you all for making time today to join David and I. I hope you really enjoyed the conversation, some of the key data points that we shared. Incredible Health is here as a partner to help you move faster, hire smarter, and lead your organization through this next phase of healthcare transformation. And as a reminder, the Incredible Health team will be in touch. We'll share the recording for today. I really thank you and have a great rest of your day, and we'll be in touch soon.
Thank you.